All righty. So for our partner spotlight presentation, we have a special presenter, and she did already introduce herself, so I will introduce her again. This is Dr. Kate McPhaul. She is here to speak about the research findings that they found on health impacts and pandemic preparedness, implications of indoor air inside homes, workplaces, and public spaces for St. Mary's County. So Dr. McPhaul, would you like to share your screen?
I'll share. So yes, Shengwen's going to share the screen.
Perfect. And we'll do a Q&A after you're finished presenting.
Okay, there are 2 times in the presentation when we're going to ask if people want to go around the room and make comments.
Okay.
So when that happens, we hope everybody that's online will feel free to just jump in there.
Perfect.
Can you see our first slide?
Yes, we can. Care about air?
Yep, and shows the back of our turtle, which is the mascot for the University of Maryland at College Park.
Love that.
Yeah, so the name of our study is Care About Air. And there are some days when I want to switch it around and say, we care about your air, and we want you to care about your air. And this is primarily indoor air. So we're hoping to convince you of that. And we think that the Environmental Health Subcommittee of the Healthy St. Mary's Coalition is a really appropriate group to start thinking about sort of the public health, approaches to helping communities think about their indoor air and act on their indoor air. So next slide. So just a little bit more about us. You've already met the 4 interns, and I'm Dr. Kate McPhaul. Where we call the Fab Lab, and this is a part of the University of Maryland School of Public Health, and FAB stands for Public Health Aerobiology Lab. And once you say that mouthful, you only want to say Fab Lab after that. But part of why you see that cone and all those particles in the logo is because a good bit of the research work being done here is looking at what's in exhaled breath when you breathe or sneeze or cough or sing into a room. So we're all indoors and we're all breathing. And when we breathe, we exhale air into the room. But when we cough and when we sneeze and when we sing and when we exercise, we put even more particles into the air from our breath. So that kind of helps you understand the type of research that we're doing. And our director, Dr. Milton, was doing this research for many, many years. And then along came the pandemic, and suddenly his research was getting lots and lots of attention. And so we are part of some of the funding that has come to the School of Public Health, not only to look at how infectious diseases may be transmitted through the air, but also the best way to educate and talk to communities so that it makes sense to them and so that they can do very specific things to take care of themselves and their families. Next slide. So we don't think we have to tell you what environmental health is, but our department here is basically the environmental health department. It's called Global Environmental and Occupational Health. And we are focusing mostly on the indoor air environment, but we are aware, as I know you are too, that environmental health also encompasses safe drinking water, food safety, safe places to live and work from the standpoint of noise, air pollution, waste, occupational hazards, job stress, that kind of thing. Next slide, please. So you might want to know why we in public health, which includes you in public health, really should care about indoor air. And one of the main reasons is that on average, we spend almost 22 hours of our day indoors. So 22 out of 24 hours is a lot of time spent indoors. And it's in those indoor spaces that illnesses that are like infections like the flu and COVID and measles, and even other illnesses that come from particles like allergy kind of particles, happen in indoor spaces. We have also seen studies that when you have poor ventilation, meaning you kind of have a buildup of old, stale air that has a lot of carbon dioxide in it and not a lot of oxygen in it, that students have difficulty concentrating, workers have difficulty concentrating and learning and working in situations with poor air quality. Also, harmful particles from the outside, like if there are wildfires like we had last summer, they weren't even on the East Coast, but they came down from Canada. The smoke came down from Canada, and you can have car exhaust and air pollution and allergens that are outside, but they come indoors if the building and home HVAC systems don't have good enough filtration. And so those kinds of issues can make people who have asthma and COPD and bronchitis and heart ailments can make them feel worse. Next slide. So just to recap, common indoor spaces are homes, schools, offices, hospitals, libraries, and you could probably think of a few more, like restaurants and theaters and places like that. Okay, we're going to go around now and ask you. In fact, I'm going to hand it over to Rithik at this point.
Yeah, so just want to ask the audience, and you can feel free to unmute or use the chat to share your thoughts. Why do you think St. Mary's County, or why should St. Mary's County care about indoor air? So you can take a moment to respond to that.
Go ahead, Frank.
Thanks. Yes, I've gotten to the point where I'm not going inside to meet with people at all. I have chemical sensitivity, bad chemical sensitivity. And even without flus, things like that being spread very rampantly inside buildings and COVID. Air quality inside could be really bad, third-hand smoke, office equipment, perfumes, and so on. I went into office building when I was at NavAir that had a carbon dioxide detector, and the CO2 levels in the room at the beginning of the meeting would be over 300 parts per million, pushing 1,000 parts per million at the end of the meeting. So that tells you how much toxins build in because of bad ventilation. So it's a big deal.
Thank you,
Thank
you, Frank.
Thank you for sharing, and yeah, we will talk about the importance of ventilation later.
Go ahead.
Sorry, I see a message in the chat from Aniko Renee. Spread of COVID with upcoming cold weather season. That's a great point. I'll get to that a little bit later. Can affect residents' health and lead to issues such as asthma and other health issues. Another great point, and I'll also mention asthma.
Troy, you had your hand raised. Go ahead.
Yeah, if I didn't get to introduce myself earlier, I'm a resident of Lexington Park, but I'm also the coordinator for the Ultraviolet Agency's healthcare working group, and have been working with Kate and her staff for a couple of years now. So grateful that she's taken an interest in St. Mary's County. Thank you, Kate. As for why indoor air is pertinent, all we need to do is remember when our brand new animal rescue facility had to shut down about a month and a half ago because of a virus that was going rampant through the dog kennels, and it was airborne, and they couldn't fight it fast enough. That's just an indicator. So, just a local example. Thank you much. This is a great session. Thank you for having it.
Thank you for sharing. So we can move on to the next slide.
Yeah, go ahead, Hrithik. Thank you. Thanks, everybody.
Yeah, so poor indoor air quality can cause or worsen chronic respiratory conditions. This includes asthma and chronic lower respiratory disease. And I'm going to a little bit later share how it those conditions affect St. Mary's County residents in particular. But it also increases use of healthcare, like the emergency room, and vulnerable groups like the elderly and young children are particularly high risk of being immunocompromised. St. Mary's County has a slightly higher percentage of people under 5 years old than statewide, and that's according to U.S. Census Bureau data. And it doesn't just impact the spread of COVID-19, poor indoor air quality, but it can also affect the spread of the flu, which is particularly relevant during the fall and winter seasons. Next slide. And so the CLRD is actually the third leading cause of death in St. Mary's County. The age-adjusted death rate is nearly double of that statewide. So that's a pretty shocking statistic. And then St. Mary's County also sees higher rates of asthma than the statewide average. And so 16.4% of adults in the county have been told by a healthcare provider that they have asthma. And that is sort of marginally greater than the statewide average. And the age-adjusted ER rate due to asthma, 68.1 ER visits per 10,000 people. That's slightly above the statewide average as well.
Okay, so we have another little interactive slide here. We want to start thinking about how we can be improving our indoor air. So if anyone has any thoughts, feel free to unmute, or you can use the chat and we can read your response out loud. How can my community improve indoor air? Someone said air purifiers.
Go ahead, Frank.
Thank you. Yes. Again, kind of picking up on what I said before, I think we need better standards. ASHRAE has standards, the federal standard, well, industry standards for improved ventilation. In a lot of cases require heat exchangers, so you're not wasting heating and cooling. But better air exchanges, better filtering will improve things a lot. And actually will also improve performance of employees because they're not nodding off because they feel crappy because of the terrible air.
Thank you for sharing. We'll definitely be talking about air exchanges later in the slides. Anything else? Someone also said replace air filters. Okay, we can move on. Thank you for all your ideas. Some other ways in which your community can be improving indoor air. So first, either as a group or individually, you can help to raise awareness of indoor air and indoor air health in general. And you can also be following the guidelines for ventilation, filtration, and disinfection, which we will be sharing more about in the next few slides. And lastly, you can educate and also speak to stakeholders such as public health practitioners, employers, pastors, librarians, principals, and also building owners and managers. So there are three main elements of clean indoor air that we are going to be talking about here. I'm just going to give a brief overview before we go in more depth later on. So first is ventilation, which can be defined as moving air in or out of a space. Second is filtration, which deals with removing particles from the air, such as dust, pollen, or really any other pollutants or germs. And then lastly is disinfection, which cleans the air by killing germs. And more specifically, an example that we're going to be talking about and that the lab here deals with is germicidal ultraviolet light, or GUV, which uses ultraviolet C light in order to kill germs in the air.
So adding on to what Catherine said, the CDC recommends indoor spaces should have at least 5 air changes per hour. So what does this mean? The room's entire volume air is replaced with new air 5 times in 1 hour, making it efficient for ventilation. The next terminology we wanted you guys to be familiar with is CADH, Clean Air Delivery Rate. Consider using the CO2 monitor as we have the picture to the right. The CDC says keep the CO2 levels less than 800 ppm particles per yeah.
Hi, I'm just doing a quick interruption here because we think this stuff is so important, but we know it's a little bit complicated to understand. So I just wanted to, circle back to something that Frank said. So carbon dioxide is a measure of what people exhale into a room. Itself, it's not toxic, but what we're saying here is that the CDC did come out with these guidelines, but it's not always possible to know what the air changes per hour are, or the clean air delivery rate is, or even the CO2 levels. But these CO2 monitors are one way that we learn about the CO2 levels. They're not hugely expensive, but public health kind of needs to figure out how to make this information available to people so that people can act on it. So sorry to interrupt, Elizabeth. I just wanted to make that point.
Thank you, Dr. McPhaul. Next, we have filtration, so removing particles. There's 3 types of kind of tools that helps filter the air. So we have HEPA, stands for highly efficient particle air filter. We have Corsi-Rosenthal box, which we have pictured to the right, those 3 different size boxes. We have the HVAC systems with the MERV 13 filters, which is a mouthful, but they look like the filters on the side of the box pretty much. And then we have disinfection, killing germs. Specifically in our situation, to disinfect the air indoors, we would use the germicidal ultraviolet light, GUV. By using GUV, the ultraviolet light energy kills germs like the flu, COVID-19, any airborne virus, mold, and so on. And it lowers your chance of getting sick in crowded indoor spaces as well, in a room full of people.
All right, so if it hasn't been abundantly obvious, our work mostly focuses on germicidal ultraviolet light, or GUV. There's a lot of terminology around GUV on the internet, and it's not very easy to navigate and understand what some of the differences are. So we're just going to go into explaining GUV at a really basic level. So there's mostly two types of germicidal ultraviolet light. Traditionally, what's been used before is this upper room 254 nanometer. This is a wavelength number, which is how long the waves are of the energy. It just has to do with what kind of energy you're using. And this is the type of ultraviolet light that falls under the UVC category. UVC is different from UVA and UVB, which you might have heard about in the context of sunlight and sun damage. So UVC is not that. But upper room UVC, which usually uses 254 nanometer wavelength light, it is used in rooms that are relatively tall. Like you can't use it on a short room because the disinfection zone is at the top of the room, and you don't want this to overlap with where people are. And the idea is you'll have a room with lots of ventilation, and it'll circle the air from down here to up here. I'm not sure if people can see the graphic well, but if you want to look at the particles, there are these red particles from this person who's sick with COVID-19. And as it floats up into the disinfection zone, the germs are killed. And that causes most of these people to breathe in safe air without active COVID-19 particles. Far UVC works a little bit differently because it uses 222 nanometer light. And this means that, or this difference in wavelength allows it to safely shine down onto people. As you can see, it can be installed in these like upright positions or at the top of ceilings. But the difference is that it'll shine in between people. So for example, if we're in between me and Katie and there's UVC shining in between us, as I'm talking in her direction, it'll inactivate whatever germs are coming out of my mouth. And she should be safe. Okay. So that is a pretty broad description of those two types. And we wanted to really emphasize the safety piece of germicidal ultraviolet light. And like I said before, UVC is different from UVA and UVB. UVB is more responsible for sunburn and skin cancer. I have a little graphic on the right of this slide. From about 200 to 254, this is where UVC is. And as you can see, it only penetrates into the stratum corneum and a bit of the epidermis. If you haven't really brushed up on anatomy, the stratum corneum is the topmost layer of your skin, and it's dead skin cells. They're not active here. And even into the epidermis, like this doesn't affect new skin cell growth, which happens at the basal layer. And as you can see, that doesn't happen until you hit about 300 and onwards wavelength light. And this is the UVB range here. UVB is what you hear when you're talking about concerns with skin cancer, and UVA is further out here. So that is a long and complicated way of saying that UVC, which is what is used in germicidal ultraviolet light, is not what is responsible for causing skin cancer in the type of UV that's in sunlight. Oops, I should have put this bullet up earlier. But yes, as you can see, UVC is safe to use in a room full of people, especially 222 nanometer light. It doesn't even reach the epidermis. It really only penetrates into the layer of dense skin cells at the surface of your skin. And 254 is safe as upper room light, but you should avoid having it shine directly onto people. So continuing with that, we want to be really transparent about the risks that do come with GUV. So looking at UVC directly from a really close range can cause temporary eye irritation. And 254 nanometers, if it's shining directly onto your skin, especially if you're working inside and it's angled down at you, it might cause temporary skin irritation, like redness and a bit of pain. Just want to reiterate again, 254 is the one that is meant to be used as upper room. So it should never be shining down on you. But in general, GUV has been used for years in hospitals and schools especially, And it's also being adopted in airports, like at Reagan National.
So I think you'll agree with me that the interns have done an amazing job explaining this. And we really just want you to understand that some of that has come from some work we've done in St. Mary's County, right? So part of us learning how to explain this and interpret the scientific literature has been coming down and talking to individuals in St. Mary's County. You have an incredible library system, and I really have to shout out Amy Ford at the Lexington Park Library. You have an amazing pastor down there, Reverend Seiler. We have talked to people at St. Mary's College. We've talked to a lot of individuals, thanks to Mr. Cowan, who's introduced us to his friends and neighbors down there. We also conducted a focus group in the Lexington Park Library where we talked to a lot of regular citizens, and we learned, you know, some things that make us a little nervous about how people get information. So part of our work, especially when we're trying to talk about not only indoor air and human health, but particularly this technology around disinfecting air, because it's something that we think could be used a little bit more and can be used safely. Next slide. So this is, you might recognize this. We're in St. Mary's County. As I said, we held multiple key informant interviews. We talked to Dr. Brewster, who is, of course, your Chief Health Officer. One of the things we learned from St. Mary's County, both the interviews and the focus groups, is that there is a high amount of trust in Dr. Brewster as a person and as the Chief Health Officer at the St. Mary's County Health Department. We feel like as the county came through the, you know, the lockdown and all the information that for how to stay safe during COVID, that people learned a lot and started to really think about indoor air and started to really trust the health department, which we think is an incredibly important thing down there in St. Mary's. It's also, as you can tell from the data that the students have found from the health department website that Dr. Brewster referred us to, it's a very diverse county, but it's a rural county too. So one of the reasons we are down there in St. Mary's County as part of our study is looking at differences in how people learn and access information and think about public health in rural, suburban, and urban settings. So we're also in Prince George's County and soon to go into Baltimore City. Next slide. Our Lexington Park Library focus group, we learned a ton. We have a lot of transcripts still yet to analyze, but one particular moment that happened during that focus group was somebody looked up germicidal UV on their phone, on their Google search. And as you know, and someone actually had to explain to me, everybody's gonna pull up something different in Google because Google sort of uses your search history to figure out what to send you. And so this lady pulled up germicidal UV and it said, you know, this is really harmful stuff. And I said, so, you know, what people need to decide is who they trust, right? And where they're going to get information from. And we're not saying that you necessarily have to listen to people from the University of Maryland, but we are saying you want to think about who you're going to trust and what information you're going to believe, because you can find almost anything out there on the internet. And people also need to figure out how they're going to evaluate information on their own. So we think that we public health people and you on the environmental health subcommittee should be in the business of vetting information so that people can understand it and so that they do know what to do. And we assume that people in St. Mary's County probably trust the people on the Environmental Health Subcommittee. Slide. This is another project that the interns have worked on this summer. This is a super, super interesting study in my view. I don't know if you recognize all of those acronyms at the bottom of this graph, but the interns looked up germicidal UV on lots and lots of websites, some places where you would hope that the website would be able to explain it to people. So places like the Centers for Disease Control, the Occupational Safety and Health Administration, the Environmental Protection Agency, the Food and Drug Administration. And basically we used this tool, this measurement that scores health information, and it scores it on clarity, like how clear it is. It scores it on jargon, like how understandable the language is. It scores it on how well it tells people what to do, like behavioral recommendations. It scores these websites on how well they deal with numbers, because research has shown that people get kind of confused depending on how the numbers are displayed. And it scores the websites on how well they discuss risk and put it in terms that people know what to do. So in other words, it doesn't overly scare them, and it doesn't downplay the risk too much. And as you can see, that red line going across the top is the score that we would like all our health information and health education materials to meet. And none of the websites met that score. And so where we are now and where our interns are is we're creating materials that can score up to that 90 level. They're doing a germicidal UV installation at our University Health Center this summer, and we're creating the materials to explain germicidal UV to the staff and the signage for the walls so that the patients that come into the University Health Center know what it is. Next slide. So we think that we want to continue partnering with Healthy St. Mary's. And we noticed that you have an organization down there called Breathe Well St. Mary's. We also think that your committee is a really appropriate partnership for us. We would like to, understand more about all the places in St. Mary's County where people might be interested in working on indoor air. And of course, next thing, we are available for assistance with community education. We'd like to test some of our educational materials through presentations at the library and elsewhere. And we plan on having a table at your Healthy St. Mary's conference in September, like we did last year with our Corsi Rosenthal air filter boxes. And that's it. So we look forward to a discussion with people and any questions. And we really thank you for your time.
Thank you so much for this presentation and your time. I'm sure, like everybody else, I learned a lot and have a lot of great ideas now going forward, how we can implement these things. I would like to open up for any questions or comments people might have. Feel free to raise your hand or take yourself off mute.
And there are some great points in the chat.
Oh, I see.
Yeah.
Yes, and Suha mentioned taking steps to ensure that everyone was working smoke and carbon monoxide detectors in their homes and educating people on the importance of this. I definitely think going forward, HSMP would love to partner with you to provide that education, whether it's sessions here, webinars, whatever we can do. We'll definitely be touching base to get that out, because this is really incredible information. And I think learning about the GUVs is another way to approach and tackle this issue without, needing COVID funding necessarily for the air filters and things like that. Let's see, and I see a question from Troy. When are you coming back to St. Mary's for a focus group?
Well, that's a great question. First, we'll come back in September for the Healthy St. Mary's. We like working with Ms. Ford at the library. That's a good location for a focus group. We can certainly do that in September or October. And I also want to do a shout out we have a communication toolkit that we're trying to adapt for various for various messengers, if you will. So the Environmental Health Subcommittee and the Health Department could potentially host the toolkit. We could adapt it for your needs, and you could use the toolkit to go off and talk to other audiences. So while we're certainly available to make presentations, and we'd love to do another focus group down there, we're also working on tools that other people can take and have these conversations as well, so that we can really scale up conversations and education on indoor air quality and germicidal UV.
Yes, we would absolutely love to continue partnering with you, and we can offer the toolkit on the HSMP website. You know, if we want to take it to the health department, we can definitely talk with our communications team about that. But I think implementing this with all of our partners that attend our meetings is extremely beneficial. And I think if, with your permission, I'd like to send an email to coordinate with Amy and maybe setting something up for September while you're in town.
Oh, sure. Yeah. I mean, Amy is wonderful, and she has an interest in GUV fixtures as well for the library. So please go ahead and do that. That would really facilitate this.
Absolutely. We'll follow up today with an email. And let's see, go ahead, Troy.
Real quickly, I'm going to put into chat a web link for our International UV Association monthly healthcare conference call, which is tomorrow at 2 o'clock Eastern. Everybody here is invited if you want to learn more about GUV, and we tend to get a little bit nerdy, and I apologize up front, but Kate's trying to straighten us out in that, and I greatly appreciate it. So there's the invitation, there's the website. The agenda for the conference will go up to later this afternoon, and the call is tomorrow at 2 o'clock. Thank you.
Thank you so much, Troy. I will add that to the HSMP calendar so that all of our members can see it and join. We appreciate that. All right. Does anyone else have any other questions or comments before we move on? All right. And I wanted to say thank you again for Dr. McPhaul and your whole team, all the students, everyone did great. I learned so much, and this has been really exciting and has re-sparked my interest in how to approach some of these things.
Thank
Susan,
you.
you're off mute. Did you want to say something?
I just wanted to note Frank's comment in the chat.
Oh, yes. Let's see. So Frank recommends a standard practice in St. Mary's County to make sure that when facilities are upgraded, HVAC is upgraded to allow recommended air exchanges. Okay, so that's something that I will put on our agenda for the HSMP steering committee, so we can bring that to Jackie and Dr. Brewster.
I think that's a good idea.
Yeah. And that steering committee meets in October, but I can get this out and going now so we can have a goal to work towards in the fall and then the upcoming fiscal year. And I also will do some research on grants for GUV, just because that's a really great idea. Go ahead, Troy.
Real quickly, when you reach out to folks inside the county, be in touch with Kim over in the public schools, because they're doing a whole bunch of ventilation upgrades.
Okay. I have Robin Schrader, the nurse with the school's contact information. What's Kim's last name?
Howell, Howell.
Okay. I'm sure she's on
Thank
our
you, Sue.
listserv, but I'll check and find out, and I will reach out to her, especially with their back to school meetings coming up that we're already attending. This is great. This is great.
She's their physical. She runs their capital programs.
Oh, okay. Thank you, Sue. See, this is why you're a great co-chair, because I did not know that. All right.
It might actually. I said Howell, but it's Howe.
Oh, okay. Gotcha.
And we are also going to drop off here because we're getting ready for another activity at 11 as well. But we just want to thank you again and give you a little time to digest this while we're offline. So
thank you so much.
Look forward to talking to everybody again, especially in September if we don't see you or hear from you before then.
You definitely will be hearing from us before then. So thank you again and enjoy the rest of your afternoon.
Terrific. Bye-bye.
Bye. Thank you.
Bye. Thanks for having us.
All right. So as we wrap up our meeting, we will go ahead and go on to partner updates. Just feel free to unmute yourself, but since I'm typing, if you could say who you are and your organization for your update, I would appreciate it. Go ahead, Frank.
Thanks. Yes, just kind of a heads up. Working with Tri-County Council, we have a new intern that's come into the council to map where existing sidewalks and pedestrian connections and so on exist, and where needs are to kind of work toward complete streets and all of that. Plus, I will be getting Chesapeake Climate Corps intern coming August 15th. We'll be looking specifically in the Lexington Park area to see if we can start getting the neighborhood connectors, which would provide public access and ability for people to walk.
Awesome. Thank you, Frank.
Welcome.
Any other partner updates?
Only to say we need volunteers for the community garden.
Okay, perfect. That segue into the one that I had. Uh-oh. Did HTML code. Just kidding, you guys. That's not what we needed. All right, so I have the community garden is offering education classes and free produce to volunteers in the community. You can join their upcoming food safety class on the 28th and their composting class on the 12th, but they do have communal garden hours on Thursdays and Sundays from 5 to 8.
And we're getting it. Sorry, ice in my mouth. We're getting to the point where we're going to have to start picking on a more regular basis. We had been picking twice a week, but tomatoes are coming fast and furious. We have potatoes that need to be dug probably in the next week or so. We're starting, we have a plethora of weeding that needs to be done. I think we could have somebody there full-time weeding and we wouldn't be caught up. So we really do need your help. So let your friends know. You can come out and get some produce and help us for an hour. I mean, you really can't stand the heat for more than an hour at a time. So
very true.
The more we have people coming, the better it'll be for everybody because we can give everybody a lighter load.
Agreed. And I will also make sure to drop off some, we just got in our bug spray and sunscreen, so I'll bring some down to the garden.
Okay. I have a question.
Sure.
And I don't know if anybody on the call will know the answer to this. The CDC has a whole bunch of out-of-date COVID tests. Are those still something we should keep or not? I mean, are they still good for use even though they're out of date?
They're only good for 6 months after their expiration date. Originally, they thought it was a calendar year, but they told us 6 months.
Okay, so we'll look at them and see what they have, and if they're out of date by 6 months, we will get rid of them because they're taking up a lot of space.
Yes, okay. And if you need replacements, just reach out. Let me know, Sue, and we will coordinate with Suha.
Yeah, I don't think we need anywhere near as many as we got last time, but I'll talk to Taylor and Carla if she's not on the call. Carla might be here though. But anyway, we will check that.
Okay.
All right. Thank you.
Thank you, Sue. All right. Any other partner updates? All right. And in the spirit of our presenter, I will include that the St. Mary's County Health Department's asthma program is continuing to enroll children ages 2 to 18, and they conduct home visits in St. Mary's County. They provide Dyson vacuums, nebulizers, lots of different good tools, and they are open to both private and state Medicaid insurance at this time. So I will include her information in the meeting minutes.
Okay.
And last call for partner updates. Alrighty, so we will move on to our close of our meeting. We have an updated communication slide because I think maybe some people get a little confused about the easiest way to contact us. You can always send me an email at aniko.renee or the Healthy St. Mary's Gmail, but we do have a form for submitting websites and flyers if that's something you want included on the HSMP website. But again, I'm always here, so feel free to reach out if you need me. We have our upcoming meetings next month, August 21st. I believe that's the first day of school. Then if you're interested in being our partner spotlight, please feel free to sign up. And we have our HSMP annual meeting on Thursday, September 26th from 8 to 2, featuring Tony from YMCA the Chesapeake as our featured keynote session speaker. Our vendor registration is currently open until August 16th. And then you'll receive an email by September 6th, I believe, confirming your spot. All right, folks. If no one has anything else, I will give you back 7 minutes of your morning, and I appreciate everyone coming and attending. It was a great meeting.
Yes. Thank you.
Thank you.
Thanks, everyone.